Swedish Cancer Institute's personalized medicine program is a multidisciplinary approach to care. A social worker is a part of your healthcare team. Social work can assist you with cancer-related concerns, for example, by providing resources on everything from quality of life to finances, or helping to ensure you and your loved ones are receiving the emotional support needed during your treatment. Oftentimes, people find that they need social work in varying degrees at different times in their treatment. With that in mind, all the information that we share in this podcast may or may not apply to you today, but you might find that it becomes of interest further down the road. In this podcast, we'll be covering what the role of an oncology social worker is, what to expect when you meet with your social worker, what a social worker can provide to you. Charla, an oncology social worker here at Swedish Cancer Institute, is here to share with us today. Now, when you hear the term social worker, you may draw an association to another type of social worker you have worked with in the past or heard a family or a friend discuss. People seem to be most familiar with community social workers. Charla, can you share with us the role of an oncology social worker is?
We are here to provide support to you and your loved ones throughout the cancer experience. During the course of your cancer care, you may feel pulled in several different directions or feel overwhelmed with diagnosis information. A social worker can help you cope during this difficult time. We will be your ally and your advocate. Our goal is to listen to your needs and make sure you have a voice in your care. An oncology social worker can also help you assess a variety of resources you may need during your cancer treatment. Resources can range anywhere from financial grant assistance to counseling referrals. Oncology social workers are here to guide you in the right direction, whether it's a resource here at Swedish or out in the community.
If I were to decide to meet with a social worker, what would the first meeting be like?
We will be asking questions that relate to your care. Privacy is important to us, and we want to respect your personal information. Your social worker will work with you in the areas you are most comfortable sharing. These questions are for the purpose of getting a full picture of your life in order to get you the best care possible.
I would love to hear more on the specifics of what a social worker can help with.
One of our biggest roles as social workers is to provide emotional support to our patients and loved ones during treatment. This includes support from diagnosis to end of life or survivorship. We can help patients cope with cancer and the treatment process, as well as communication strategies when talking with their spouse or partner, children, or coworkers. We can assist with finding ongoing counseling services in the community, as well as peer support if patients would like to connect with someone that has gone through a similar experience. Social work can provide quality of life resources, such as services for chores around the home, transportation assistance, respite care, and palliative and hospice programs. We are able to discuss legal documents related to advanced care planning. This includes advanced directives and living wills, durable power of attorney, physician's orders for life-sustaining treatment, or often called a POLST form, and assistance with attorney referrals. Finances and costs of care are often a significant stressor among patients. After an assessment, social workers can determine eligibility for financial assistance. These programs can include Swedish's Financial Assistance Program, in which our social workers work alongside with a financial advocate to help them navigate medical bills, community grants and patient assistance funds, Social Security disability benefits, and general Medicaid and Medicare information. Social workers can help patients connect with a variety of other supportive care services, such as support groups, both diagnosis-specific or general support groups, exercise and nutrition resources, relaxation techniques for anxiety, advocacy around work or school, healing arts classes, appearance resources such as wigs, makeup classes, and head coverings, survivorship planning, general cancer and treatment information, and advanced care planning and symptom management.
As you have heard, a social worker can be a tremendously positive support during your cancer care. Each patient brings a unique experience, and an oncology social worker will work with you and other members of your medical team to provide personalized care. If you would like to reach your social worker, you can ask your oncologist for a referral or call the Swedish Cancer Institute Social Work Information Line. At First Hill, that number is 206-386-3228. For Edmonds Campus, 425-673-8255. 8328. For Ballard, 206-781-6359. And Issaquah, 425-313-4224. To get the most from this service, please contact your social worker to set up an appointment. And thank you for joining us today.